Welcome to one more session of our YouTube and Instagram live. I hope everybody is joined in early so that we can start. And yeah, Ashwarya joined well. Let us start our YouTube live. So before that, let us see one case first, and let us see one remedy first. First of all, a very interesting case of coryza, simple case of coryza. But let us see how the remedy worked. That's important for us. Okay. For example, I'll just tell you something about the remedy first. Before that, welcome Dr. Meera, Dr. Care Clinic. I hope you can hear me properly, everybody. So now the season of coryza is there, and we have a lot of cases of coryza. But there are some symptoms of some remedy which are very, very important, especially some very common remedies like Pulsatilla. In Pulsatilla, remember one thing is very, very important. In Pulsatilla, if there is coryza with stomach disorder, normally what happens, a lot of people eat outside food, and because of the rainy weather and because of the lot of pollution, you get diarrhea, dysentery and all. And whenever you get coryza with stomach disorder, you have to think about Pulsatilla. It is not only Pulsatilla which works basically. You have to think with Pulsatilla like Brownia, Pulsatilla, Carbovoge and Staphysagrilla. But the most important remedy in these type of complaints is Pulsatilla. Welcome Dr. Palak, Dr. Disha. Now, if you are understanding Pulsatilla, 2 or 3 things very, very important. In Pulsatilla, the coryza is normally during sleep. Now, whenever the patient is suffering from coryza, and it is basically during sleep, normally there are only 2 remedies. One is very rare, I can get the name right, but Pulsatilla has never disappointed me. So there was a lot of questions in regarding Pulsatilla nose symptom. That's why I'm telling you some symptoms of Pulsatilla nose. Third thing, in Pulsatilla, the coryza is generally recurrent. If you have a case of recurrent coryza and you have tried a lot of medicines, for example, you have given tuberculinum, you have given arsenic, you have given rustox, it is not giving results. Think about Pulsatilla, think about Silicia, think about sulfur. These are very, very important remedies where the coryza is recurrent. Okay, recurrent coryza. It is not always that Pulsatilla will work, but symptomatically, if your symptom selection is right, Pulsatilla would do wonders. Of course, Pulsatilla is very commonly indicated in these type of complaints. I hope you can hear me because we are at a new location, so that if you can't hear me and if there is some disturbance, you can always write so that I can adjust. Yeah, hello Dr. Babal, Dr. Neha. Next thing in related to Pulsatilla. Now it is always said that whenever if the patient has some peculiar symptom, that becomes very important. For example, Pulsatilla has discharges fluid only one-sided. Patient comes and tells you that I have discharge one side of nose, I have discharge other side of the nose. एक ही नाक से पानी बहता है. Now this again becomes a very, very important and very, very interesting symptom of Pulsatilla. Discharge which is very fluent and from single nostrils. So you can think about Pulsatilla is there, Nux vomica is, Belladonna is there, Rhododendron is there, but Pulsatilla has given me very, very good results. So these are the 3 or 4 symptoms that you must think about Pulsatilla. I had a very interesting case, the patient was suffering from anemia. The patient was suffering from anemia. He had taken a lot of tonics. When he took tonics, the anemia was good. When he stopped, back to square one, his HB was always less. And he suffered from recurrent coryza also. He came to me for the treatment of recurrent coryza. And after the case taking, the coryza symptom matched to the patient, and then I prescribed Pulsatilla. And the coryza was much better. The most important thing was the HB of the patient, which was always between 8 to 8.5. After treatment of 4 months, jumped to 12.8. It is so interesting, and I just looked into the mathematics of Pulsatilla, and Pulsatilla has a very, very important symptom, coryza with anemia. Coryza with anemia, and this was a very interesting symptom which I found in Mathematica. So Pulsatilla not only cured the coryza but also treated the anemia. So whenever, if you have a case where there is coryza with anemia, think about Pulsatilla. Of course, ferrum is there, Kalicarb is there, China is also there, but pulsatilla is also there. So it is said that when your case taking is good, and if the case taking is good, and if you get some results, do introspect your case so that you can get some more symptom of that remedy to understand, and you can use that remedy, and your application of that remedy becomes a very wide. Otherwise, we only think about ferrum, in case of anemia and all, other remedies are missed out. So this is about pulsatilla. Yeah, welcome Dr. Amisha. Hi ma'am, good afternoon. I am Naveen. Okay, I am Dr. Chimthanawala. So fan. I hope you can hear me clearly because there are a lot of other noises in this clinic. Most important symptom is coryza. One more symptoms of pulsatilla you must add is coryza with photophobia. Now this is a very common, the patient comes to us and that मुझे बहुत सर्दी और आँख में एलर्जी है, आँख बंद करना पड़ता है, बहुत तकलीफ होती है, देख नहीं पाता हूँ. So whenever there is coryza with photophobia, of course pulsatilla is there, Merxol is there, Euphrasia is there, arsenic is also there. These are very, very important remedies where you have to think about, Hitman. Okay, so Hitman. So this is pulsatilla, coryza or sardi with photophobia. So in general, this is something very, very common symptom in related to pulsatilla. So I have a lot of some other symptoms, but if you have some question to ask, you can start writing. Mr. Farman, welcome. So you can start writing so that I can answer your questions according to what you want, because this is basically a learning process. So I would be happy that if you start asking questions, that also helps me to brush up my mater medica. Okay. So anybody with ready questions? Or I can start comparing pulsatilla with other remedies, and the half an hour gets over and we don't know what to, IBS, how to approach. Yes, a very, very important question, a very, very interesting disease. I would say a very, very intriguing disease. Sometimes I also find it difficult to cure. First of all, let me tell you, irritable bowel syndrome. I have so many cases which I have not treated but cured. A lot of cases on camera also. I have cases. I think put a lot of cases on YouTube also, and in Insta. I think on Facebook also. So irritable bowel syndrome. Most of the cases of irritable bowel syndrome which I have seen in my practice, don't always keep asking the the patient, how are the stools. They will tell you variety of stools. The more chronic the complaints, the more variety of stools they have. Somebody will come and tell you first time that my stools are very watery, brown, offensive. Next time he comes, now the stools are basically pasty, it is yellowish. Next time he comes, now the stool is like orange, stools are very painful. Every time the patient comes of chronic IBS, he will start telling you something different symptoms about stools, and then after 2-3 months you come and say, oh, the stools are changeable, and you select a changeable remedy. Don't do that. If you keep prescribing only on symptoms of IBS, you will only be able to cure symptoms of IBS and not the patient. So stool symptoms, of course, it is every time the stool symptoms are same and it is very unique, it is a different thing. But remember, irritable bowel syndrome is basically because of the irritation in the mind. It is called as the brain-gut connection. There has to be some irritability in the patient. I distinctly remember a case where the patient had suffered, a very young boy, of I think 16-17 years, had irritable bowel syndrome. Whenever the exam comes, he was very agitated and he had to go for stools lot of times, And when asking the history, told me, my father is a doctor, my mother is a doctor, and every time I go for an exams and every time I want to perform something, my parents do not pester me, but I know that I am son of the doctor, so I have to be very good. I have to clear this exam, this entrance exam. People are watching me. What will the patient think about? So there are a lot of things, which always keeps in my mind, and that's why I get so anxious, I get so agitated. I have to go for stools. He said previously I could not digest only non-veg, and now sometimes I cannot digest some simple food also. So gradually he started not eating those things which would cause troubles, but he landed up in a state where he could not digest major food. And then after taking the history, we got the irritability, we got the anticipation, and what rubric I took for prescription. That's a very fantastic rubric which I took for prescription. What I told you, the parents, yeah, good afternoon, Dr. Navjot, Dr. Meera, the Dilip Raut, we basically did not take, or the patient did not tell that my parents are dominating or my parents want me to study, but he himself thought, he himself had that I have to become a doctor, I have to score good marks, I have to do this, I have to do this. So which remedy comes to your mind? This was one line symptom which my assistant doctors who are with me, they took a beautiful case and we got a fantastic remedy on the one symptom the patient told. I'm just telling the summary of the case. Which remedy comes to your mind, or I can say which symptoms can you think about or rubric you can think about in such type of cases? Anybody? Very fast, we can't waste time, it's already 12 minutes over. What symptoms comes to your mind? What interpretation of rubric that comes to your mind? Anybody? Fast. One or two symptoms and then we'll push off to others. Dr. Babel, Dr. Meera. Kali Kaab, Dr. Palak says. Why Kali Kar? A very interesting rubric, anybody on YouTube or any other rubric you want to understand? Kali Kar, anything else? Dominating oneself, yes, very nice. Dr. Mega, very nice. So we took the rubric, there was self-dominance. So every time don't take the rubric elements from dominance because the parents are dominating, the boss is dominating, the husband is dominating or the wife is dominating. It is a simple rubric, but sometimes you can also have self-dominance. You feel so anxiety of conscience that because everybody wants to me to perform, so there is self-dominance, there is self-thought, there is self-dominating thoughts and the patient wants to perform. I gave him the simple dose of Lycopodium 1 mg single dose the first month. I repeated the second month and gradually the patient started improving. His relationship with parents increased. He tried to came out of the situation. He did very well in the NEET exam. He cleared the NEET exam and now he's studying in the MBBS second year. So this was a case of Lycopodium 1 mg of irritable bowel syndrome. And I hope with the short description, whoever asked me the question, I don't know because it must have scrolled up. I hope you understood. This is one aspect of treating irritable bowel syndrome. It's a very vast topic, but this is one of the examples, one of the cases which I wanted to share so that you can understand. Irritable bowel syndrome is not only related to how is the stools, when is the stools, what is the color, the consistency of stools. It is more related to the constitution. It is more related to how you think, how irritable you are, and how do you perform in anxiety, how do you behave in the society. That's how the irritation starts. So I hope everybody understood the case. If you understood, just give me a thumbs up or just give me a beautiful heart so that I understand. I know that if you are at par with me and you are understanding what I wanted to share with you. This is treating one aspect of irritable bowel syndrome. Try to always think about this aspect before you are labeling the case with one of the drugs, one of the remedies. Till date, no thumbs up and no hearts. So due to understand, in Instagram I always get good hearts, but in I think YouTube, I think nobody understood how. I hope you understood that. Okay, everybody. Dr. Babel, Disha, whatever, Hitman, Mega, very well said, Dr. Mega. So, whenever you are treating, any other question? Dr. Medicos joined, yes. Sultan joined, Babel, yes. So, now we are talking about, Dr. Disha, thank you. So, we were talking, are there any other questions regarding irritable bowel syndrome? See, I can go on and on, depending on the stools is like orange pulp, stools is like chopped spina, stools is grassy green, stools is like frogs, ponds come. There are different type of stools, but my experience treating only on the color of the stools and the consistency of stools, you'll be only treating the stool complaint of the patient. Okay, so I hope yes. So this is care clinic. Okay, if you don't have questions, some symptoms I am remembering about Pulsatilla. If you want, I can share that with you. Pulsatilla, normal, what happens in Pulsatilla? The complaints of nose are aggravation lying down. The patient comes to you in the chamber and says, doctor, whenever I go to sleep, there is obstruction of nose. When I sit, it is better. Whenever I lie down, whether it is night or day, I get obstruction or nose complaints. That is Pulsatilla. BD Homeopathy, welcome. Yes, sir. How to approach peptic ulcer disease? See, APD, any disease related to acid peptic disorder, whether it is gases, distension, peptic ulcer, a lot of this. APD, hello, Dr. BD Homeopathy. Acid peptic disorder. Now, simple, if you have read the books of medicine, Davidson or API or Harrison, there are, it is basically the nerve of the mind that goes to the stomach. Whenever there is some unfulfillment in your life, I'm just telling one aspect of treating, okay? Whenever there is unfulfillment of life, you are so agitated, you are so angry, you become an acid constitution, you always keep suppressing those thoughts, and that's why the nerve, the just pours acid on in the stomach and the acidity increases. You must have seen in a lot of cases the patient says that I eat only 2 chapatis in the morning, 2 chapatis in the evening, and only salads and fruits. I have never eaten junk. I don't drink. I don't smoke. I don't eat pizza, burger, maida. But still hyperacidity, taking protein pump inhibitor, omeprazole, rabeprazole for years and years together. I hope everybody has got this type of cases. And sometimes I also used to think that now where is the acid coming from? So maybe 10 years, 15 years before my practice, we had a very interesting remedy told by our seniors. Whatever acidity you have, if you don't understand, give Robinia. Robinia used to treat the complaints, but never cure it. So whenever there is suppression of your thoughts, you want to speak something, you cannot speak, you are very agitated, there is a lot of anguish. The nerve throws acid, the vagus nerve throws acid on a lot of bronchioles, capillaries, nerves, arteries are there, which keeps pumping acid in the stomach, and that's why the hydrochloric acid level rises and you get severe acidity, which goes up, and sometimes it is represented in the form of GERD or APD or burning in the esophagus or Barrett's esophagitis. These are a lot of complaints, or then you get valve problem, and these are all complaints. So one of the aspect in understanding and going through the case is understanding the environment and the social status of the patient. How is the patient going? And that's, you will feel that the poor patient is eating nothing, still there is so much acidity. This is how I have treated a lot of cases. Just one note before I take a new question. There's a remedy in a Mater called Pepsin. Have you ever heard the name Pepsin? Anybody? Pepsin. Pepsininum it is called. Anybody? Have you heard Pepsin? Yeah, a lot of my junior students who are with me, they are raising their fingers. So Pepsin basically is a very interesting remedy, pepsinogen, prepared from pepsin only. So go to the Mater of pepsinogen, go to the Mater of trypsin. Especially pepsin is a very, very interesting remedy. Though it's a rare remedy, though you might not have used that remedy in your practice, but go home and read pepsin. You'll understand it is such a interesting remedy for most of the APD disorder, acid peptic disorder. Read pepsin, read iris versicularis, read trypsin. These are the very interesting remedies, not thought about, but next time I'll ask you the question. Next time I'll ask you what understanding or what symptoms you found very useful of pepsin or chymotrypsin or trypsin in your cases, and this or iris versicularis, these remedies will help you in treating a lot of cases of acid peptic disorder. So next time the question is for you. So next time I want some answers from you. Yeah, Dr. Gaurav, welcome. There are one question on Instagram, Dr. Meera. Yeah. So for right otitis media, I had one case of 30 having hole in the right ear with discharge. Unbearable pain, advised surgery. Okay. Yeah. I mean, I got that case on the WhatsApp also. So I was just fetching the OPD, so that's why I could not answer it, and that's why I was about 5 minutes late on the Insta and YouTube live. So this is a very interesting case. Whenever you have a case, if I don't know the history of the case, but whenever you have a case where the right side ear is very, very painful, two remedies are very, very, very important. One is Merck Idoflavus and second is Belladonna. In this case, if you are better with acute complaints, there are few remedies very, very important in this case, Dr. Meera. Think about Aurum Metallicum. First, Second, think about capsicum. And third, think about Merck cyanide. One of the three remedies. If you ask me, if you put on some symptoms, I'll be able to differentiate these remedies, and you will be able to get the case right. Don't go for surgery, because in surgery the doctors will can't give a guarantee. It may again land up with the same complaints after a few months. So it's very important that you treat the case with homeopathy and you will get the results. Thank you for one heart, Dr. Gaurav. So on YouTube there are only few questions, and the doctors are less to do on YouTube. So I think you understood something about pepsin today and APD disorder. I hope Dr. Care Clinic, whoever is asking me that question, I hope you understand and read those remedies. If I would understand, treating remedies or treating patients with remedies like pepsin. There are 2 or 3 symptoms which are very important. A peculiar symptom of pepsinogen, it has a physiological action. Peptones, peptones, it is said it is for imperfect digestion. Whenever the digestion is imperfect and you are not able to get the remedy, think about pepsinogen. Pain in the region of stomach, the patient has neurasthenia, disease of nervous system, surgical diseases, gastric cancers, ulcers. These are all cases where you can think about pepsinogen. Especially, write down in your Mater Medica. Especially, I have seen lot of cases where the children are fed on artificial foods. I have lot of patients from Europe, and in Europe, they are feeding children with some artificial foods because the husband and the wife both are working and the poor child is staying in a crush. So whenever the children are fed with artificial food, you must, and they suffer from marasmus, you must think about the remedy pepsinum. Pepsinum, pepsinum, a very very interesting remedy, a very very important remedy in these type of complaints. I hope you understand and prescribe the remedy in low potency and repetition. Yes, thank you, understood, Dr. Care Clinic, Dr. Zinat Rizvi, welcome, Dr. Prasad. Some doctors I have missed welcoming because I was busy answering the question. So this is something which I wanted to tell you about APD and all. Any other question? Dr. Meera, aurum metallicum, think about aurum metallicum, capsicum and Merck cyanide. Patient having empty feeling along with stitching in the right umbilical in the morning. See, whenever you get cases of region of umbilicus is very painful. Now, normally what happens if the umbilical region is painful and you think about some remedies, 2 or 3 remedies which are very very important, which I have seen in my practice and I have got good results. Of course, if you open the Mater Medica or the Repeat, there are so many remedies. But especially, Dr. Navjot, especially in the morning, there are 2 or 3 remedies which are very very important. First is diascoria, second is epismel, third is natrum carp, and fourth you must think about is chelidonium. But 2 remedies again I would differentiate. Epismel and diascoria have given me very good results whenever there is pain in the umbilicus, around the umbilicus. Okay, Dr. Babel, Pulsatilla. Yeah, I hope you understood Pulsatilla, and that's what I understand what you want. Pulsatilla is, I hope you understood Pulsatilla, and maybe there are a lot of other symptoms of nose which I have not told, but there were a lot of questions in our YouTube, and Facebook and WhatsApp. So I just told something about Pulsatilla, So this is something about Pulsatilla and this is something about APD and all. Can we have few more questions? It's only 25 minutes. If you ask questions fast, then I can also answer fast. Otherwise, in Mater Medica, I wait a lot of time. Dr. Navjot, I hope you understood the remedy epismelific and diascoria, chelidonium. Very, very interesting and important remedy. I had an interesting case, when the pain was general, extending back to the umbilicus. Veratramal cured that case. Of course, I failed in once and twice and thrice. Okay, the fetus died. Okay, fine. So, sir, I have a patient who keeps on irritating child by pulling hair of classmates. What rubric can I take? No, see, don't go for the rubric. First understand the child. Why is doing it? You will see, what lot of children, where they are spoiled child. They get everything anytime, anywhere. They don't fear because they know the parents can handle any situation. So they're absolutely fearless, and that's why they can play any prank and they cannot be caught. Second, these type of child, if you understand, are called as mischievous children. And if you ask me, just pulling hairs, I had cases where the children used to tear the books. There was one child used to take a bottle of water and pour in the bag of the topper so that he does not get good marks and good marks in the book completion and all. So there are few remedies where the child is absolutely mischievous, the child is absolutely destructive, the child very envious, child very jealous. You may think about remedies like anacardium, you may think of remedies like chamomilla, nux merxol, hyoscyamus, lachesis. Of course, spoiled child remedies you already know, spoiled children like we have ammonium carb, lycopodium, brata carb, sulfur, moscus. So these, at first understand, every symptom you can't have rubric because then your interpretation may differ and my interpretation may differ. But just take a broad rubric, mischievous children or spoiled children, and you can get to the remedy. Okay. Do we have some more questions? It's already only 5 minutes are left. Please ask questions fast so that basically I hope you understood Dr. Care, and think about these remedies. Praveen Khandelwal, welcome. You can think about these remedies, chamomilla and nux vomica. Very, very interesting remedies. Nux vomica, I hope everybody knows it. But whenever I read nux vomica every day, I feel, oh my God, I have not known nux vomica, because every time you read a remedy like polycrest, like nux vomica, it has so many symptoms, which we have not been able to understand. And as your practice increases, nux vomica's application also increases because it is such a widely used remedy. Nux vomica, these children are why so mischievous? Because they want to achieve, they have desire to achieve lot of things, and if they don't achieve, then you have these type of children, mischievous children. This is nux vomica. Sir, in pemphigus vulgaris cases, therapeutically, what remedy can we think of? Pemphigus vulgaris, let me tell you, very, very difficult type of cases to treat. I have cases where I have treated these cases with Merxol, anthraxinum, arsenic, sulfuric acid, arnica. These are very, very interesting remedies. If you understand pemphigus vulgaris and see these remedies, it has lot of symptom in their therapeutics, in their drug proving, which covers pemphigus vulgaris. Okay, so I hope you understood that. Nux vomica, I was telling you, they want to achieve so many things in life. That's why they are persons who want to achieve, and that's why there's a problem in them. In nux vomica, it is a very interesting symptom, elements from literally or scientific failure. When the person knows that he cannot perform, he cannot exceed in life, and there at times comes, he becomes very mischievous, he becomes very cruel, he becomes like this, he has to do it, means do it. So nux vomica is there, lycopodium is there. In fact, elements from literary failure, calcarea, carb and pulsatilla is also there. So this is how you have to keep reading your Matermedica. So every time you read Matermedica, something new symptom crops up, some new thing comes up, and you feel, oh my God, I have not seen this in nux vomica, and nux vomica will cure it. Okay. Any organ remedy or mother tincture for pemphigus. That's what I told you, organ remedies and all. You can think about remedies like what you call a Merxol and all, organ remedies only. If you still feel, you can think about hydrastis. There is one rare remedy also you can think about is Huang Nang. Huang Na is again a very rare remedy. You can think about turpentine, also interesting remedy, and simple remedy for ulceration, hydrastis also is a good remedy you can think about in material doses. Okay. Psoriasis amelioration winter, you can take, you can go to your repertory doctor and think about winter ameliorates, and there are a lot of remedies. If you basically, if I told you only one remedy is not always that would work, but be generalized, winter ameliorates. And in psoriasis, there are a lot of symptoms that is written in one book, sometimes winter ameliorates and winter aggravates. In other books, summer aggravates, summer ameliorates. So if you say winter ameliorates, One remedy that I have used lots in my practice, and it is very close to psoriasis also, and that remedy is sulfur iode. A very, very interesting remedy. Sulfur iode in where winter ameliorates, my dear doctors. Remember sulfur iode. Again, that remedy is also covered in psoriasis also, and psoriasis units also. Thank you, Dr. Care. I hope you have learned and you apply in your practice. And next time we get to know that you have got results in whatever I have shared with you. So, my dear friends, it's already half an hour up, and thank you for joining and thank you for spending your time. And I have to now, yes, I am practicing in Ramdaspet area, Dr. Meera. I have just shifted to Ramdaspet. Yes, I am surprised that you have come to know so early. It has just been a week. I think I have shifted to Ramdaspet. So, my dear friends, I hope you enjoyed as much as I enjoyed teaching you. Until next Saturday, goodbye and meet you on Insta and YouTube Live on next Saturday. Thank you so much.